Since almost day one of the pandemic, there's been debate about exactly how kids are affected by the coronavirus. At first, we were told kids didn't seem to be getting it. Then we were told they did, but that they weren't getting severe cases. Then we were told of complications they could develop after the fact, but that they still don't spread it like adults do. Well, now a new study out of Mass General Hospital may be turning that wisdom on its head. And this one could be a game changer for parents and school administrators getting ready to send kids back into schools. I'm joined now by Dr. Alessio Fasano. He's the senior author of that study and director of Mass General's Mucosal Immunology and Biology Research Center. Doctor, thanks so much for joining me. I really appreciate it.
Thank you, Jim, for having me on your show.
So, as I said, for months we operated under the assumption that kids are not affected by the virus. You're suggesting that assumption is wrong-headed. What did you learn?
Well, the study was initiated indeed to understand why the kids were spared, because that's what the epidemiological evidence suggested so far. And with our major surprise, we learned that one, yes, the kids are not spared by the infection. They may eventually get infected with this virus that is present in their upper airways. Sometimes the levels are even higher that we've detected in adults. They are seriously ill to the point to be admitted to the hospital in the intensive care unit. And when infected, most of the time, they have little or no symptoms. So they are, under the stealth kind of radar screen in order to be identified as infected kids with the coronavirus.
So again, let me be clear. They could have no symptoms. They may not suffer severe consequences, get seriously sick themselves, but there's this high viral load. I want to just repeat what you said, that you found the level of the virus in some of these kids was higher than the level of adults who were in the ICU suffering from COVID-19?
Correct.
That is stunning. You didn't specifically look into the transmission issue, but you concluded that they would be transmitters. Why did you reach that conclusion if your research didn't get you there?
That's true. I mean, we just, spell out the facts. The fact is that these kids, they have this large number of viral particles in their upper airways. These are, data that were generated not just looking at the genes, like the one that we do with the swab. They say there must be a virus there without knowing if it's live or not. This is where looking at the viral particles. We know there are viruses, they are live in there. And if they're there, based on years and years experience with any other, virus that, infected the airways, if you sneeze or cough, they will get out of there. They will be in the environment. And if you're nearby, you're susceptible, you got it. But we don't have the proof, of course. We never did that.
But that seems pretty obvious to me as a layperson. But as I'm sure you know, Doctor, a number of other researchers have criticized your research on that front, saying, yes, of course, they have the virus, but they doubt the conclusion that they're serious transmitters. Why are you confident in your conclusion? It's
not that I'm confident. I just put the facts out there. And the facts are the kids that have virus in their airways, they are a large number, and they are alive. So if they're a transmitter or not, it's something that, again, I don't have confidence. I say that's based on the experience with other virus, they potentially can transmit. I don't have the confidence by saying that for the first time ever, because it would be one of a kind, having the virus there, they would not be able to transmit. If we will have that evidence, that's great, but we don't have those either.
So, Doctor, how should your findings influence school administrators and parents as everybody is agonizing over what to do about school reopening in the coming weeks?
So I'm a scientist and a clinician, so I provide data. The policy needs to be, decided by policymakers based on this data. Sure. So now that they have this information, they need to, eventually decide accordingly how to handle the reopening of the school. And if you decide that it's going to be in-person, classrooms, then you need to keep this information, in mind by implementing policies to make, a safe environment for these kids and the operators in the school.
But it seems to me to be a pretty powerful argument for those who believe, at least in starting the fall semester with remote learning, no?
Not necessarily so. Again, Jim, we learned a great and dearly painful lesson during these pandemics. At the beginning, we were convinced that only senior people and people with precondition were susceptible to infection. Now we have a second wave in which the average age is 35 and 40. Why that happened? Because these people in this age range did not behave to obey to the public health policies and recommendation to decrease the spreading. We're going to have the same problem in kids if we don't do the same. But if we wear masks, if we keep physical distance among kids, if there is a frequent, hygiene in terms of washing hands, the kids they can go back to school.
Doctor, before you go, one other major development in the state. Massachusetts, as you know, has just become the first state to mandate flu vaccine for all kids from young right up through college, as old as age 30. I want to ask you a quick question about it. Here's Governor Baker on that subject.
People who get the flu shot and don't get the flu and don't end up in the ER and don't get the flu and don't end up in the hospital, the more capacity we'll have to actually serve the people who do have COVID.
In a world in which there are far too many anti-vaxxers, is there any question in your mind that Governor Baker did the right thing?
No question in my mind. I really admire how that, Governor Baker has been handling, the pandemic in Massachusetts. We are ahead of the game on many other states because he's really got to the mark to do everything that was supposed to be done. With the flu, the rationale that I see there is that, coming the flu season, if we don't vaccinate these kids, they will develop the symptoms that will lead to the belief these kids are infected by COVID-19. And in the practical terms, it doesn't matter if you open the school that you have in person or remote, we can have a collapse in the school system. And I believe that was a wise decision from the governor to mandate, the flu vaccine. That's what we do anyhow. As a healthcare professional, every year we have to be vaccinated to protect the others and ourselves so that we don't spread the flu every year.
Dr. Fasano, thanks for your time and thanks for your work. I really appreciate it.
Thank you so very much. Again, on behalf of the entire MGH group, thank you for spreading the word and make our kids safer.
Very kind. Thanks.